A deadly hantavirus outbreak has been dominating the news headlines this week, and in this video I want to talk about the astrology surrounding this event and how it's coincided with some specific planetary cycles over the past month, especially the Saturn-Neptune conjunction and the Mars-Saturn conjunction, which just took place and went exact in April. All right, so we're first things first. So the short version of the story is that there's a virus outbreak that took place on a cruise ship over the course of the past month that's resulted in a few deaths, as well as the World Health Organization starting to trace and track people that got off of the ship and started to fly to different places around the world. And the good news is that the virus is not as highly transmissible as something like COVID was, for example, in 2020. But the bad news is that when it is transmitted, it's much more deadly compared to something like COVID, which had a much lower mortality rate. So the World Health Organization is currently saying that this is not likely to become a worldwide pandemic, which is good news. But nonetheless, they're in the process of trying to deal with it right now, and it's just been dominating the headlines over the course of the past week, especially in this first week of May. I'm recording this on May 8th, 2026. All right, so from a background, from the perspective of an astrologer, this is something we were nervous about and something that we had actually, I predicted in our year ahead forecast for 2026 when we were looking at that Mars-Saturn conjunction, because it reminded me of the Mars-Saturn conjunction that took place in March and April of 2020, which is right when COVID was declared to be a pandemic and right when the lockdowns took place and right when a bunch of people were getting sick with COVID at that time, including myself. So I want to play a couple of clips just to show that we were sort of like anticipating something like this happening, going back as far as December, at the end of December, when we released our year ahead astrology forecast for 2026. And later in the forecast, we specifically started talking about the Mars-Saturn conjunction that would take place in April. So I'm going to play those clips now where I said, quote, Mars-Saturn conjunctions also in like traditional and ancient astrology are traditionally associated with the outbreak of like plagues and pestilences and things like that. And we certainly saw that in 2020, where there was that big stellium pileup in Capricorn that the lockdowns ended up peaking on the Mars-Saturn conjunction around that time.
Yeah.
And Saturn-Neptune conjunctions themselves are, we saw in the Saturn-Neptune episode earlier this year, sometimes associated with different types of, plagues and things like that breaking out. So that's not great. Like I'm not liking that aspect in terms of things, in terms of our traditional worst planets. Okay, so that's the first clip. And then in the second clip, this is a clip from our forecast for April, which we recorded in March of 2026, where we kind of returned to and reiterated some of that and expanded on it a little bit in terms of the predictions we had already made about the Mars-Saturn conjunction in our year ahead forecast. So I'm going to play that clip now where we said, quote, yeah, one of the things it reminds me of is especially this Mars-Saturn conjunction that's going to peak mid-month, is it reminds me of the stellium that happened in like March and April of 2020 when the COVID lockdowns hit, especially in the US, and that Mars-Saturn conjunction, especially that happened in Capricorn and Aquarius, and everything just suddenly like ground to a halt. And
And as we've described both described both in advance and in retrospect over the last many years, the Mars-Saturn conjunctions on a macro level, on a historical level, are most unfortunate. They describe very difficult periods of time. We were using them during the COVID peak to literally predict when the death tolls would spike, because they coincided very, very cleanly with when things would get worse. And so
New variants kept showing up every like Mars-Saturn alignment, especially conjunction.
Yeah. And they're used throughout the tradition of astrology to time disasters, to time illness. In natal charts, you derive the lot of enemies and the lot of illness from the relationship of Mars and Saturn, as well as the lot of death.
Okay, so that's the predictions that we made, end quote. And where we were kind of like concerned about the conjunction. And one of the things I want to do is go through the timeline because looking at it now, even though the headlines are just coming out now, while Mars is moving away from the conjunction, but is still co-present in a sign-based conjunction with Saturn, so that conjunction is still operative. It's interesting now that they're retracing the timeline, how well it ended up lining up with the Mars-Saturn conjunction in retrospect, even though at the time it was something that was like just developing quietly on this cruise ship before now a month later it's become this worldwide like news phenomenon where headlines are covering it all over the place. So let's go through the timeline of this outbreak and look at how it did end up coinciding with the Mars-Saturn conjunction as we were kind of concerned about. All right, so here's the chart for the Mars-Saturn conjunction and the diagram that we had put together and used then, where using a 10-degree orb, we can see that Mars started to come into the conjunction with Saturn by early April, even while it was moving through late Pisces, and then that conjunction really accelerates starting April 9th, once Mars moved into the sign of Aries, where it was fully co-present with Saturn as well as Neptune. Then eventually the exact conjunction hits on April 19th between Mars and Saturn, and then it goes outside of the 10-degree range by early May, so that the intensity of the degree-based aspect starts to drop off. But in terms of the sign-based aspect, Mars is going to stay co-present with Saturn all the way through the middle of May. All right, so let's look at the actual charts then for that time period, starting in early April, where we see Mars is at 23 degrees of Pisces on April 1st, and Saturn is at 5 degrees of Aries. All right, so in terms of the timeline, what happened is there's this luxury cruise ship that departs from Argentina by late March, by April 1st, basically, by late March, early April. And health officials are currently hypothesizing that the initial passengers were exposed to the Andes strain of the Hantavirus before embarking. And but then where things get interesting is when we jump forward to April 6th. So here's the chart for April 6th, and Mars now is at 27 degrees of Pisces. So it's just moved within the 10-degree range with Saturn, which is at 6 degrees of Aries. And what happens is that on April 6th, there's the first suspected case where there's a Dutch male on the ship who begins showing symptoms of fever, headache, and mild diarrhea while he's on board the ship. So this is like right after Mars enters that 10-degree range, as we were noting in the previous diagram that I had made for the year ahead forecast episode and that I had my graphic designer Paige make for me. So then we jump forward a few days to April 11th is the next major date on the time frame. And so this is a couple days after Mars has moved into Aries, where it's now fully moving into both a sign-based as well as a degree-based conjunction with Neptune at 2 degrees of Aries, Saturn at 6 degrees of Aries, and Mars itself is now at 1 degree of Aries. So that conjunction is becoming very close. And what happens on this day is that the Dutch Dutch man who got sick, his condition rapidly progresses to severe respiratory distress, and then he dies on board the ship on this day. So originally, though, this was attributed to natural causes because there was no microbiological tests that were performed at this time. So the first death from this outbreak takes place right as Mars and Saturn are moving into that exact degree-based conjunction. So now we jump forward then about a week, where if I animate the chart to April 19th, we see the conjunction going exact between Mars and Saturn at this time, with Mars at 7 degrees of Aries and Saturn at 7 degrees of Aries as well. So this is the date of the exact Mars-Saturn conjunction. And what happens is that just a few days after this conjunction, starting on April 23rd and 24th, the ship stops at St. Helena in the Atlantic, and the body of the deceased passenger is taken off the ship. But in addition to this, they're saying now between 29 and 40 passengers disembarked from the ship at this point and began traveling home to various countries, including the US, the UK, Australia, Switzerland, and the Netherlands, unaware of their potential exposure to the virus. So among those disembarking is the wife of the deceased man who had just passed away a week earlier. And the wife is already experiencing some symptoms of the virus at this point, some gastrointestinal symptoms. And this is really crucial to me because this is the event that occurs right after the conjunction, and a bunch of passengers basically disembark to a bunch of different countries at this time, potentially spreading the virus right after the conjunction has gone exact. So then we jump forward a couple of days to April 25th and April 26th, where we see that Mars is at like 12 Aries and Saturn is at 8 Aries, just coming off of the conjunction. And at this time, the wife's condition severely deteriorates during a flight to South Africa. And then the very next day, on April 26th, she actually dies on arrival at a hospital emergency department in Johannesburg. So this is then the second death in connection with this virus that's taken place. So then the next day, on April 27th, we see Mars at 13 degrees of Aries and Saturn at 8 degrees of Aries. The ship arrives at Ascension Island, and then a British passenger who is suffering from severe shortness of breath and pneumonia is medically evacuated to an intensive care unit in South Africa in critical condition. And the cruise ship then leaves the island. So then we jump forward another day to April 28th. And then a German female passenger begins developing a fever and feeling unwell on board the ship. So eventually we jump forward to this past week to May 2nd. At this point, we see Mars is at 17 degrees of Aries and Saturn is at 9 degrees of Aries. And on this day, there's a German passenger who dies aboard the ship. And then the cluster of severe respiratory illness is officially reported to the World Health Organization as a concern, while at the same time, PCR laboratory testing in South Africa officially confirms that the evacuated British man has a hantavirus infection. So this is the first confirmation that one of the passengers had the hantavirus at this time. So then everything starts moving pretty quickly at this point. We get to May 3rd, and I'll move the chart forward one more day. And at this time, the boat anchors off the the coast of Cape Verde, and local authorities deliver medical supplies and start establishing isolation protocols, preventing passengers from freely disembarking. Then the next day, on May 4th, we move forward one more day, and the World Health Organization officially publishes a disease outbreak report regarding the multi-country hantavirus cluster. And posthumous PCR testing confirms that the Dutchman's wife, who died on April 26, was also positive for the hantavirus. So health authorities at this point begin an urgent global contact tracing program for the passengers who left the ship back at St. Helena. So that kind of brings us up to the present time, where by May 5th, we see Mars is at 20 degrees of Aries and Saturn's at 9. So we're still in this co-presence when on May 5th, a Swiss passenger who had disembarked at St. Helena tests positive for the hantavirus in a Zurich hospital in Switzerland. Then the World Health Organization announces suspicions that this outbreak involves a rare human-to-human transmission of the Andes hantavirus strain, which is likely passed between very close contacts, basically on the ship. Then the Spanish Health Ministry agrees to receive the ship in the Canary Islands and to assist with medical evacuations. One of the things I find interesting about this is that this day also we have Mercury squaring Pluto while Pluto is stationing in Aquarius. And at this point, it's like the news of this outbreak being a rare strain of the virus that's human to human transmission is starting to come out basically, and that's what we're seeing under those two aspects of like Mercury square Pluto while Pluto is stationing. Then let's move it forward one day to May 6th, and on May 6th, the World Health Organization officially confirms the outbreak is the Andes virus strain, which is the only hantavirus strain that's known to occasionally spread from person to person. And at this point, there's three people, including a British crew member and the ship's doctor, who are medically evacuated from the ship to the Netherlands for specialist care. And then yesterday, May 7th, global contact tracing intensifies for the 29 to 40 passengers who left from the ship and dispersed to different parts of the world. And public health authorities in the US, including in Texas, as well as other countries such as Singapore and the UK, report that several located passengers are currently asymptomatic, but have been placed in strict isolation for up to 45 days, which is the maximum incubation period. And additionally, a flight attendant showing mild symptoms is hospitalized on this day in Amsterdam for testing. So finally, the last report bringing it up to the current day, May 8th, when Mars is at 22 degrees of Aries and Saturn is at 10 degrees of Aries. The latest report today so far that I've read was that the ship is continuing its journey to Spain, where the remaining passengers and crew are expected to be quarantined and then eventually repatriated. And as of today, the World Health Organization is reporting a total of 5 confirmed cases of the virus, as well as 9 suspected cases, with the death toll currently standing at 3 people. So the World Health Organization maintains that while human-to-human transmission has occurred in this confined cluster, the risk of a broader global epidemic remains low. All right, so I wanted to spend all that time going through that timeline and showing you how it's lined up so far, because one, it's going to be a good case study for all of us to remember as astrologers in the future, but also because I've seen similar things play out in the past over the past decade, and that's one of the reasons why I made those predictions and why we made those predictions, because we've seen different versions of this play out in the past, where part of what we've learned in doing mundane astrology, part of what I've learned in doing mundane astrology over the past decade is that pandemics and the outbreak of viruses and diseases and things like that have to do partially from an astrological standpoint and a mundane standpoint with the timing often coincides with a mixture of outer planet cycles and important outer planet alignments and especially conjunctions like long-term ones that happen infrequently, but also the coincidence with shorter term planetary cycles such as Mars and Saturn, which take place approximately every 2 years and can oftentimes be or can coincide with or act as sort of like a trigger for some of the things that are happening with the outbreak or the awareness of certain viruses, as well as the attempts to control and suppress them. So the most famous instance of this, of course, was the COVID pandemic in 2020, which was on the one hand, in terms of outer planet cycles, we connected with a very rare conjunction of Saturn and Pluto that went exact earlier that year in January of 2020, which also aligned with some eclipses. There was also just a big pileup of not just Saturn and Pluto, but also Jupiter. And then there was also some inner planet cycles that coincided with the peak of the pandemic when Mars eventually came into Capricorn and Aquarius, where it conjoined Saturn and Pluto, which ended up being a really important turning point, a pivotal turning point when the lockdowns took place and when COVID was declared to be a global pandemic by the World Health Organization. So, I want to spend some time going through the timeline of that so that you can see part of the parallel that we were thinking of in the back that I was thinking of in the back of my mind when I was looking at this upcoming Mars-Saturn conjunction. And then we can dive a little bit more deeply into some of the outer planet cycles. So let's start first with looking at the COVID pandemic and doing a timeline of that, especially as it was connected with the Mars-Saturn conjunction. Okay, so let's do a chart for let's start in January of 2020 because in January of 2020, that's when the Saturn-Pluto conjunction took place. And things are really starting to develop at this point, and that was the biggest outer planet cycle that year that all of the astrologers were nervous about and that we are all concerned looked kind of ominous in different ways. But that outer planet cycle went exact in early January, around January 12th. And at that time, Mars is in early Sagittarius. So it's headed towards the conjunction and the co-presence with Saturn, but it's not there yet. So Mars moves through Sagittarius during the course of January and the early part of February, and then Mars moves into Capricorn by February 16th. And this is where we're going to start our timeline because this is when Mars comes in and acts as the trigger for COVID, which is already spreading around the world and is already starting to get noticed by late December and early January of 2020. But then when Mars comes in, there's like this, it sort of acts as this trigger where it really starts to become visible and the world really starts to wake up and become aware of it and try to take action to combat it and to fight it. So February 16th, 2020, let's start the timeline there. And okay, so February 25th, about a week later, after Mars goes into Capricorn, is when our first most important event takes place. February 25th, Mars is at 6 degrees of Capricorn, and it's moving into the conjunction with Jupiter at 8 degrees of, well, Mars is exactly conjunct the south node on this day. It's moving into a conjunction with Jupiter at 18 Capricorn, then Pluto at 24 Capricorn, and then Saturn at 27 degrees of Capricorn. So what happens at this point is that on February 25th, the US CDC, the Centers for Disease Control and Prevention, warns the American public to prepare for significant disruptions to daily life, signaling that community spread in the US is inevitable. So then we jump forward just 3 days later to February 28th. Now Mars has moved. It's still at 8, or it's at 8 degrees of Capricorn now, closing in on that conjunction. And on February 28th, the first reported COVID-19 death is announced in the United States in Washington state, although subsequent autopsies will later reveal that undetected COVID-19 deaths had occurred weeks earlier. But this is the first reported death of COVID in the US. Then the very next day, on February 29th, the US Food and Drug Administration begins loosening regulations to allow labs and hospitals to conduct their own COVID-19 tests to combat severe testing shortages. Okay, so that's February 29th. Then we're going to jump forward to March 11th. And if I advance the chart for those watching the video version, by this point on March 11th, Mars has moved to 16 degrees of Capricorn, So it's now within 15 degrees of a conjunction with Saturn, which now has moved to 29 degrees of Capricorn. And on this date, the World Health Organization officially declared the COVID-19 outbreak was a global pandemic. So this is a super important turning point when the WHO officially declared that this was a full-fledged pandemic. Then 2 days later, on March 13th, the US government declared that COVID-19 was a national emergency, which then freed up billions of dollars in federal funding. Then on March 16th, the White House issues its 15 days to slow the spread guidelines, urging Americans to avoid gatherings of more than 10 people to work or school from and to work from school or home to work from home um, or school rather than like going there in person if possible. So this is on March 16th. And what's interesting about that is that March 16th, Mars is now at 20 degrees of Capricorn and Saturn's at 29. So this is the point where the orb between Mars and Saturn starts becoming really intense because now it's within 10 degrees of a conjunction. And now the government is starting to like encourage people to work from home. Um, which what was funny about that at the time in our year ahead prediction, Austin and Kelly and I had famously talked about how during this part of March there would be no hugging because that was like how we were looking at this symbolism of this like coldness and distance of having all of these planets line up in Capricorn at this time, especially when the moon would swoop in there at the same time over that few day period. And we talked about there being like no hugging during the third week of March became one of our famous predictions at that time. And what happens is basically like the lockdowns start coming into place and the social distancing starts happening at this time and starts being recommended by the government. All right, so we jump forward a few days to March 19th, and at this point, California becomes the first US state to issue a statewide stay-at-home order, and several other states, including New York and Illinois, quickly follow suit. So this is when like states officially start issuing the stay-at-home orders. Then we jump forward about a week to March 27th, and here, Mars is now at 27 degrees of Capricorn, and Saturn has just moved into 0 degrees of Aquarius, but they are now moving very quickly in this day within the 3 degree range, which is like the next jump up in terms of intensity after the 10 degree range. And what happens is that on March 27th, the US government signs the $2.2 trillion CARES Act into law, providing direct stimulus payments to citizens and creating the Paycheck Protection Program to keep businesses afloat. So this is when some of the economic stuff starts going on that has different pros and cons we're not going to get into. But the very next day, on March 28th, the White House extends its social distancing guidelines until the end of April. So the whole social distancing thing and the lockdowns are becoming really important and are in place at this point. So after that, we move forward to April 2nd. Well, in the interim, actually, the Mars-Saturn conjunction goes exact. So on March 31st, Mars has moved into Aquarius and it exactly conjoins Saturn at 0 degrees. So part of what was unique about the COVID pandemic and this Mars-Saturn conjunction is the degree-based conjunction peaks here on March 31st, which is basically right in the middle of the lockdowns, right in the middle of sort of the height of the craziness of everything. But because the conjunction took place across two signs, that it started in Capricorn when Mars and Saturn first moved into the same sign together, it gets extended longer than other Mars-Saturn conjunctions do because then the sign-based conjunction ends up extending across both Capricorn and then Aquarius. So it was one of the unique things about the COVID pandemic and about the lockdowns, which becomes very interesting as we'll see. So All right, so on April 2nd, just a few days after this conjunction, Mars is now at 2 degrees of Aquarius and Saturn's at 0 degrees. On March 2nd, sorry, on April 2nd, global confirmed COVID-19 cases surpass 1 million. So we're talking about millions of cases that have occurred at this time, right as we're right in the middle of the Mars-Saturn conjunction by degree. Then the next day on April 3rd, reversing earlier guidance, the CDC formally recommends that all people wear non-medical cloth face coverings in public settings to prevent asymptomatic spread. So before this, they were saying like no masks. Now they're saying like wear masks or some sort of face covering by April 3rd. Then we jump forward a week to April 11th. Mars is at 8 degrees of Aquarius and Saturn is at 1 degree. And on April 11th, for the first time in US history, all 50 states, Washington, D.C., and most of the territories are under a major disaster declaration simultaneously. So that's a crazy historical first in American history. Then later in the month, we jump forward to April 28th. And at this time, Mars is at 20 degrees of Aquarius and Saturn is at 1 degree of Aquarius. And on April 28th, the United States becomes the first country to surpass 1 million confirmed COVID-19 cases. Then 2 days later, on April 30th, Mars is at 21 degrees of Aquarius. And what happens at this time is the US government officially launches Operation Warp Speed, which was a massive public-private partnership aimed at accelerating the development, manufacturing, and distribution of COVID-19 vaccines and treatments. Then we jump forward a few days to May 1st. Mars is at 22 degrees of Aquarius. And on May 1st, the FDA issues emergency use authorization for the investigational antiviral drug remdesivir, making it the first authorized therapeutic treatment for severe COVID-19. So they're starting to develop some of these things to like mitigate it using different drugs and things like that, as well as starting to develop the vaccines and everything else, as Mars is starting to move out of the degree-based conjunction with Saturn. So then May 2nd, the very next day, the World Health Organization renews its emergency declaration from 3 months prior, which emphasized that the pandemic remains a profound global public health crisis. And then we jump forward about 10 days to May 12th. And this is our last major event. Notice in this period, notice that Mars is at 29 degrees of Aquarius. So this is right as Mars is getting ready to move out of Aquarius and move out of the sign-based conjunction with Saturn. And on this day, on May 12th, several states begin enacting phased reopening plans. For example, Arizona rescinds an earlier executive order that required a 14-day quarantine for out-of-state visitors, which reflect a localized push to resume economic and social activities despite ongoing transmission. So basically, from this point forward, the most intense phase of the lockdowns, which were happening in March and April, start to get reversed by some of the states, and then slowly over the course of the next month or two, things start to open up again, just as Mars is moving out of that co-presence with Saturn. All right, so I wanted to go through all of that in detail because I wanted to demonstrate how there's often two things going on. There's, on the one hand, big outer planet cycles that are taking place sometimes, which can signal like a really big pandemic that's because it's signifying major like world-shaking events taking place. Like in the instance with COVID, it was the Saturn Pluto conjunction that had gone exact earlier that year. And that Saturn Pluto conjunction, the last time one of those happened before COVID was in the early 1980s, like 1980, 1981, 1982. 1983 when the AIDS pandemic was just exploding and coming into the public consciousness. So, on the one hand, we have two instances of that in recent memory in terms of, most of our lifetimes. The last two times that conjunction has taken place has coincided with the outbreak of a major pandemic. So, on the one hand, we have outer planet cycles that are happening sometimes, and um, on the other hand, we have like medium or inner planet cycles that are happening more frequently, which can act as trigger events and periods of intense focus on the outbreak of a disease or a virus, as well as the attempts to combat it and the attempts to contain it, basically, to stop its spread. And that's part of what we were seeing there with the Mars-Saturn conjunction, especially, which coincided with the lockdowns in especially March and April of 2020. But that wasn't the only time actually that I've seen that happen. The first time that I saw it happen really vividly in terms of world events and in terms of just like watching a Mars-Saturn conjunction take place in the sky and watching the world in the headlines talking about like a major virus that was spreading that they were trying to combat and to contain was actually back in the year 2014 when there was a Mars-Saturn conjunction in Scorpio that went exact in August, and this coincided with a major outbreak of Ebola in Africa that was starting to threaten to spread around the world until luckily attempts to contain it were successful. So let's actually take a look at that and do a timeline breakdown because you'll see some really interesting similarities. All right, so we're going to start our timeline on July 25th, 2014, because on this day, this is the day that Mars moved into Scorpio and began the sign-based conjunction, or what I call a co-presence with Saturn, which it will eventually culminate in late August, about a month later, around August 25th, when Mars exactly conjoins Saturn and Scorpio. All right, so let's do a timeline breakdown here. And interestingly, so this is July 25th, the day Mars moves into Scorpio. The very next day, on July 26th, we have our first event where an American physician working at a hospital in Monrovia, Liberia, tests positive for Ebola. And so he and a fellow American aid worker who also then tested positively not long after that draw massive international media attention to the escalating crisis, which is starting to spiral out of control at that time. So then we move forward 3 days, and on July 29th, a doctor who's the leading physician and hero of Sierra Leone's Ebola response tragically dies from the virus, underscoring the extreme danger that was faced by frontline health workers at that time. And on July 29th, Mars has moved into about 2 degrees of Scorpio at this point. So then next, we're going to move forward to early August, to between August 2nd and August 5th, when what happened is that Dr. Kent Brantley and Nancy Wright-Bull are medically evacuated to Emory University Hospital in Atlanta, Georgia, in specialized containment units. And they become the first known Ebola patients to be treated on U.S. soil. So as a result of this, this is starting to hit all of the headlines and starting to become major news during the course of this week, of course, in the US. And that's when I'm starting to see it as everybody else is. So then we move forward to August 8th. By this time, Mars is at 7 degrees of Scorpio and Saturn is at 16 degrees of Scorpio. So they've now moved into that important 10-degree range where the conjunction starts becoming much more intense and the events associated with it become more acute. And what happened is on August 8th, recognizing the severe international threat, the World Health Organization officially declares the West African Ebola outbreak a public health emergency of international concern. So this was a major turning point when the WHO basically officially occurred this like a public health emergency that was concerning for internationally for the entire world. And that kind of parallels then that announcement we saw in March of 2020 when the World Health Organization declared COVID was a pandemic, just as Mars was moving into that conjunction with Saturn, just as it is here. So then we jump forward a few days to August 12th. We see Mars is at 10 Scorpio, Saturn's at 17. And what happened here is that because of the unprecedented scale and high mortality rate of the outbreak, the World Health Organization Ethics Panel officially endorses the use of unproven experimental treatments and vaccines for infected patients. So then we jump forward 8 days to August 20th, and we see Mars is at 14 and Saturn is at 17 degrees of Scorpio. And at this point, so the conjunction's really intense. And on August 20th, in a desperate attempt to curb the spread of Ebola, Liberian military and police forces violently quarantined the West Point slum in Monrovia, which is a home to 75,000 people. So this ends up sparking intense riots and clashes between panicked residents and security forces. Then one day later, on August 21st, um, Dr. Brantley and Nancy Wright-Bull are discharged from Emory University Hospital after successfully recovering, demonstrating that early intensive support care could defeat the virus. So that was a piece of good news. Then, about a week later, we move forward to August 26th, and this is the day after the conjunction. So the conjunction goes exact at 17 degrees of Scorpio on August 25th, 2014. So the next day, the Democratic Republic of Congo notifies the World Health Organization of a brand new, completely geographically isolated Ebola outbreak in a different province, and health officials quickly confirm that it's a different strain and completely unrelated to the West African epidemic. So what was annoying is like there was already one outbreak of Ebola, and then all of a sudden there's this other Ebola outbreak that gets announced literally like the day after the Mars-Saturn conjunction takes place. Then on August 29th, a few days later, Senegal announces its first confirmed case of Ebola, where there was a young man who traveled across the border, making it the fifth West African country affected by the epidemic. All right, so then we jump forward to September 2nd. By this point, Saturn's at 18 degrees of Scorpio and Mars is at 22 degrees of Scorpio. And on this day, Doctors Without Borders, the international president of it, delivers a stark briefing to the United Nations where she warns that the world is, quote, losing the battle, end quote, to contain the outbreak. And they plead for wealthy nations to deploy civilian and military biological disaster response teams. So it's really bad at this point, and they're really desperately asking for help. Then September 5th, Mars is at 24 Scorpio and Saturn is at 18. And on this date, the World Health Organization releases an emergency roadmap outlining a massive coordinated international response to try and halt the outbreak within 6 to 9 months. And at this point, the official death toll passes 2,100 people, although the health agencies warn that the true numbers are likely much higher because of how hard it is to document it everywhere. So then we jump forward to September 10th, which is our last date before Mars leaves Scorpio. And on this day, good news emerges from Senegal as health authorities report that their initial and only imported Ebola patient has recovered. So essentially, aggressive contact tracing prevents any further spread, which then paves the way for the country to eventually be declared Ebola free. So things didn't end at this point because it ends up like still peaking over the course of the next month or so in terms of the statistical peak, like the next month or two, where Liberia experienced its peak in late September. Guinea reached its highest week in terms of case counts in mid-October, and then um, and so on and so forth. But what happened is that the Mars-Saturn conjunction and the co-presence coincided with this really critical inflection point in the crisis, where the trajectory was kind of changed because, on the one hand, the virus fully entrenched itself in different dense populated capital cities, which is kind of what we were seeing with the COVID pandemic around that time in March and April of 2020. But also, there was this global awakening where the infection of Western aid workers and their subsequent evacuation triggered this massive international media coverage and a scramble for containment. So, there were also issues with um, local healthcare infrastructures were just getting completely overwhelmed at this time, which led to some of those desperate pleas from organizations like Doctors Without Borders for global military and medical intervention, which they then got some of, which then helped to fight and eventually curb and stop the spread of the virus. So that was really important to me because that's like one of my examples that was in my memory bank of what happens sometimes around Mars Saturn conjunctions, where you have this important inflection point when a disease and the deaths and the infections associated with it become really prominent in the news. And sometimes it leads to greater awareness and identification of that, which is an important step in terms of fighting it. But also, these can be periods of like heightened fear and worry and concern as people are kind of like concerned about if they're going to get sick, or people are freaking out about if it's going to spread and what the implication of that is, and so on and so forth. So that becomes a really important piece of it as well, sometimes in terms of periods of heightened concern and heightened fears. Another recent example of this that happened much more recently was in 2022 during the monkeypox outbreak. And this was something we were following at the time because in the forecast episodes, this is the next Mars-Saturn conjunction that occurred after the COVID lockdowns Mars-Saturn conjunction in March and April of 2020. So you jump forward 2 years later, and on April 5th, 2022, there was another Mars-Saturn conjunction in Aquarius. So we were kind of like waiting and watching that one to see what would happen. Because, I mean, one of the things that kept happening during subsequent Mars-Saturn hard aspects in that 2 year interim period is we kept seeing important turning points in terms of variance. I'll skip that here and just say we were kind of relieved initially in April that it seemed like the Mars Saturn conjunction came by and went, and nothing major happened in terms of like another pandemic. But then over the next couple of months, what happened is in the news, we started seeing these reports about monkeypox. And then that summer ended up being the summer where everybody started worrying about monkeypox because there was an outbreak and a spread of that virus. And when it was eventually traced back and they started figuring out what happened, it turned out that the first events related to it could be traced back to the first week of May, where May 6th and 7th, the UK Health Security Agency confirmed the first case of the outbreak in London in a patient who had recently traveled to Nigeria, where the virus is endemic. And so what that meant is essentially that the Mars-Saturn conjunction, which just occurred the month earlier on April 5th of 2022 in Aquarius, ended up being like the sort of ground zero starting point for it. And then from there, after the conjunction, it ended up spreading over the course of the next few months and over the course of that summer until it became like international news, basically. So let me share the chart for that just so you can see what I'm talking about, where here's the conjunction on April 4th at 22 degrees of Aquarius. And then Mars eventually moves on. And by early May, you get the first case taking place, or first reported case. but it's interesting because it's then presumably from an exposure that was happening the previous month around the time of the conjunction. So that has some parallels then with the current one that we're experiencing, where um, in the last Mars Saturn conjunction in April, it's like you start getting the first cases of it, but they were expected to be cases where the people got it before they boarded the ship, and then they started getting sick and started passing the virus on this cruise ship during the course of the Mars Saturn conjunction. So it was weird seeing a version of that summer that we could sort of like trace back in terms of proximity and in terms of exposure to the Mars Saturn conjunction that happened just weeks before the first cases were reported. Another really interesting one that I've talked about in a previous episode was the Mars Saturn conjunction that coincided with the naming of AIDS in 1982. And so I did a whole episode on this. It was episode 409 of the astrology podcast that I did with astrologer Gary Lorenzen. And it was a really important episode that we released on July 16th, 2023. And it was titled The Astrology of the AIDS Pandemic. And in this episode, we were primarily focused on how the AIDS pandemic coincided with especially the Saturn-Pluto conjunction that was happening in the early 1980s, just in the same way that the Saturn-Pluto conjunction, that the next one that happened in early 2020 coincided with the COVID pandemic. So um, let me put the chart up and then I'll do a little brief timeline of what we found and what was so critical that we learned from doing that episode in terms of Mars-Saturn conjunctions acting as additional important triggers on top of the slower moving outer planet alignments. Okay, so here is the chart for June 17th, 1982. We see that Saturn is at 15 degrees of Libra. Pluto is at 24 degrees of Libra. So Saturn's been moving through that sign certainly by like 1981, like 1980, 1981, Saturn goes into Libra. It starts the long sign-based co-presence or conjunction with Pluto, and which it eventually sort of culminates around 1983. And eventually Saturn moves into Scorpio. But then what was interesting is Pluto moved into Scorpio later on. So we get an extended Saturn-Pluto co-presence that lasts over the next few years until eventually by like 86, Saturn is moving into Sagittarius. So as a result of that, it's like the first half of the 1980s have this extended Saturn-Pluto co-presence that's really coinciding with the emergence of AIDS as a global pandemic, especially in the United States, but in the world in general. And a really important point happened over the summer of 1982 because part of what happened is there was a retrograde that happened where earlier in the year it's like Mars went into Libra, but then it went retrograde. So they had this entire retrograde in Libra with Mars during the course of that year that extended the entire co-presence between Mars and Saturn and Pluto to create one long one. And so what ends up happening is this is when the AIDS pandemic is really taking off and starting to come into the public consciousness more, but also they're starting to realize that like how it's transmitted, and they're starting to understand that it's going to impact a lot more people than they think at first. So let's jump to a specific date in June, though. I'm not going to do the entire timeline here because I did a whole episode on it with Gary. So I'll refer you to that for that really important episode, honestly, that I think everyone should watch for multiple reasons. But we're going to go to June 18th, 1982. And at this time, this is Mars at 8 degrees of Libra, conjoining Saturn at 25 Libra and Pluto at 24 degrees of Libra. So, um, during the course of this summer, like I said, the medical understanding of the disease shifted from being a localized, what they were calling like a quote unquote gay disease at the time, to a broader public health threat. And on June 18th, 1982, the CDC published a report titled, quote, "A cluster of Kaposi sarcoma and pneumonia among homosexual men residents of Los Angeles and Orange County communities." And this provided the first concrete link between a sexually transmitted agent and the outbreak itself, which had been developing and coming into greater consciousness over the course of the past couple of years, essentially since the last Mars-Saturn conjunction, basically. But this Mars-Saturn conjunction, which also coincided with the retrograde, which is part of what made it more important, is when it really starts to come into the public consciousness and they start to figure out what's going on. So after this point, we're going to jump forward a month to July 16th, 1982. And at this point, Mars is just past the conjunction with Saturn. Mars is at 20 degrees of Libra, and Saturn is at 16 degrees of Libra, and Pluto is at 24 degrees of Libra. And what happens is that at this time, the first reports emerged of the disease affecting hemophilia patients who had no other known risk factors, such as sexual orientation. So this led the medical establishment essentially to realize that the disease was bloodborne rather than something else. Then we're going to jump forward 11 days to this very important date on July 27th, 1982. And on this date, Saturn's at 16 Libra, Pluto's at 24, and Mars is at 26. And why this date is important is because at approximately 2 p.m., a meeting was held by the National Institutes of Health to resolve the terminology for the crisis. And prior to this, researchers used various names, including GRID, which they were calling it gay-related immune deficiency. But then the term acquired immune deficiency syndrome, or AIDS, was the acronym, was officially established during this afternoon meeting. So this date, which Gary talked to me about and shared with me, was the date of essentially the chart for the naming of AIDS. And eventually the name gets used publicly for the first time in September. But there's something really important about this date, and just that this was the date in which AIDS officially got the name that it would become known by, and officially, in that way, becomes like the birth. It's like, on the one hand, Gary, I was rewatching part of that episode recently, and one of the things he said that struck me was that um, up until the point of this summer, especially he was talking about men in the gay community started realizing that there was this disease that was going around, but it wasn't clear where it was coming from and how it was transmitted. So it was hard to deal with and hard to figure out how to avoid. But then over the course of this summer, both they started figuring out slowly the transmission route, but also it started being named and recognized as something that was impacting and was going to impact a lot of people. And specifically, the recognition of it by giving it this name, which was a more general name rather than one that was just falsely thinking that it was only applying to the gay community, essentially. All right, so there's other ones that we could go into, like for example, the Mars-Saturn conjunction on April 10th, 2024 in Pisces, where there was an explosion of headlines about bird flu because it was starting to spread to US dairy cattle and crossing over into human workers. And there was headlines about that at the time. But I'm going to skip over going into other instances because I think now, even with just the examples I shared, we can start to see why in traditional astrology and in ancient astrology, some astrologers associated Mars-Saturn conjunctions with like plagues and pandemics and sickness and other things like that, and important turning points related to that. So, for example, the 12th century astrologer Guido Bonatti, at one point he says, quote, "And if Mars were joined corporally to Saturn, it signifies a multitude of fevers and pestilences." Or the ninth century astrologer Abu Mashar, he says at one point that Mars-Saturn conjunctions, quote, "It has the characteristic property of the excessive occurrence of smallpox, pustules, and eruptions," end quote. And, part of the philosophy, I think if we step back a little bit more broadly behind this and the philosophy underlying what's going on here from a traditional astrological perspective is that from the perspective of like an ancient philosopher like Aristotle, you have these notions that everything in the universe is in this constant process of either coming into being or passing away. And from an astrological standpoint, the two benefic planets, Venus and Jupiter, are associated with the process of coming into being and building things up and increasing or stabilizing things, whereas the function of the two malefic planets, Mars and Saturn, is the process of passing away, which can include, in certain contexts, the properties of things like sickness or even death. And in terms of mundane astrology, we have some really famous instances of astrologers in the past using a combination of Mars-Saturn conjunctions and outer planet conjunctions to try to understand the beginning of different pandemics and things like that. So, for example, in the year 1348, in connection with the what was called the Black Death plague in Europe, there was this huge outbreak of the plague that occurred at this time. And in the year 1348, the King Philip VI commissioned the medical experts at the University of Paris, and he asked them to explain what was going on with the Black Plague, which had broken out all over Europe at that time. And at this time, astrology was integrated into medicine and into the medical universities as a diagnostic tool. So the medical faculty basically at this time ended up creating an official report, and what they ended up concluding was that the root sort of like ground zero of the pandemic, they traced it back to a triple conjunction of Mars, Jupiter, and Saturn that occurred in the sign of Aquarius in the year 1345. And they believed that this was sort of like the starting point, essentially, of the pandemic. And in fact, that was roughly when it starts coming into Europe at that time. And they were identifying that planetary alignment as being really crucial in terms of that. Now, the difference, though, between what they thought then versus what we think, or at least what I think now, is during that time in the medieval period, astrology was conceptualized and the planets were conceptualized as causing events to happen because they believed the planets were influencing things on Earth and able to influence things like the elements or the temperaments or the humors associated with the human body. So they believed that the planets were sort of like corrupting the air as a result of this conjunction. So for me though, and I think for most astrologers today, we don't have the conceptualization necessarily that the planets are causing events to happen, but only that they are mirroring what's happening on Earth or somehow signifying the things that are happening on Earth, sort of like a clock indicates that it's, 10 o'clock in the morning or what have you, without necessarily being the reason or the cause for why those events are taking place. And there's different philosophical things that we can get into that I'll skip over for the purpose of this because it's outside of the scope of this. But I just wanted to make that clear in terms of my conceptualization of what I'm seeing here is that I'm seeing some sort of timing mechanism that's happening underlying reality in concert with events that are taking place in our world and in terms of the sort of public consciousness of everybody that's here living on Earth. And sometimes where either large groups of people are being impacted by things, by getting sick or dying of diseases, or are getting impacted by things like lockdowns or other things like that, or having sometimes mass psychological experiences such as fear surrounding like a pandemic that's broken out or what have you. But in all instances, it's not, and I want to be clear that I'm not arguing that the planets are causing this to happen, but instead they're just a useful tool for timing different things that happen in the world, and especially because the planets coincide with events on Earth, that sometimes you can pick up on repetitions because if a certain planetary alignment coincided with something in the past, you can sometimes try to distill the core of what happened during that planetary alignment, and then you can project that out into the future because some version of that will repeat again in the future in terms of world events when a similar planetary alignment happens in the future. So, for example, we had the um, Saturn Pluto conjunction in 2020 that coincided with the COVID pandemic. And the previous COVID pandemic, or sorry, the previous Saturn Pluto conjunction in the early 1980s coincided with the explosion and the recognition of the AIDS pandemic. Or you have other ones, like, for example, the Mars-Saturn conjunction that coincided with the lockdowns in March and April of 2020. And you can compare that to, for example, the Ebola outbreak that was happening over the summer during that Mars-Saturn conjunction in Scorpio. And you have the sudden awareness of an outbreak like that, but also the attempts to contain it. And we're seeing a parallel between, for example, what happened then in the attempts to contain something with Ebola under the Mars-Saturn conjunction in the summer of 2014, and what's happening now in terms of the Mars-Saturn conjunction in over the past month and the outbreak of the Hantavirus, as well as the attempts to contain it. So I want to belabor that point just because something I've come to see more and more clearly over the past several years that seems so simple, like when you think about it, when you step back, but is actually really important and deep and profound, is that repetition is the key to prediction in astrology. And when a person especially familiarizes themselves with different planetary cycles and studies how they've worked out in history, it can give you some ability to make predictions about what will happen in the future the next time similar planetary cycles align as they did in the past. So, prior to 2020, most astrologers hadn't done work. I hadn't done work like looking at the astrology of pandemics like we have today, because I hadn't experienced in my lifetime what a major pandemic was like in the early stages, because I was born in like 1984. And so it's like I wasn't there for like, ground zero of the AIDS pandemic as an astrologer. Otherwise, I would have been seeing some of these things happen. However, and most astrologers for that matter, hadn't studied pandemics that much prior to 2020. However, there was one astrologer who did. There was a French astrologer, famous mundane astrologer from France named André Barbault, and he actually had done a study of pandemics, and he published a book on the topic in which he ended up in the year 2012 predicting that there would be a major pandemic taking place in the years 2020 and 2021 based on his study of outer planet cycles and how they had aligned with pandemics in the past. So I've already done an entire episode about this, so I'm not going to go into it in detail. You can check out episode 254 of the Astrology podcast, which was released May 11th, 2020, when Lisa Scheim and I, there was like, there was like headlines at the time being like, no astrologers predicted this pandemic. And in fact, the one astrologer who did an extensive study of pandemics and attempted to make predictions specifically related to pandemics actually did. So you can check out that episode. It's titled on the podcast website Misconceptions About Mundane Astrology in the Media, which was the original title, although on YouTube you can find it under the title Did Astrologers Predict the 2020 COVID Pandemic? So what's interesting about this case, to summarize it, is that André Barbault, like I said, he was a French astrologer who died in October of 2019, so just before the COVID pandemic really started and broke out. But in 2012, he published an article titled Survey of Pandemics. And what he did in this article is he studied outer planet cycles that coincided with major pandemics in the past century. And then he used that information to make a prediction that the next such alignment would take place around 2020 and 2021. So he originally wrote this article in French, but this is a translated excerpt of part of it. So he wrote, to return to pandemics and looking back over the past century, the four crises of 1918, 1954, 1968, and 1982 stand out. The two massive ones having been the first, the famous Spanish flu, which claimed, it is said, 25 million lives, and the last one in which AIDS took hold, which is even more devastating and continues to be lethal. Since then, there was also a weak flu surge in 2009, right up against the last lowest cyclical index in 2010. It could well be that we are seriously threatened by a new pandemic at the 2020 through 2021 mark, at the lowest point of the cyclical index of this entire 21st century, with the quintet of slow-moving planets gathered within 100 degrees. A Jupiter-Saturn-Pluto conjunction could particularly and even specifically lend itself to the fabric of this imbalance. End quote. So that was like the core of Barbault's prediction. And what's impressive is that he wrote this article and published it in 2012, and then he dies in October of 2019, just before the COVID pandemic begins. So he doesn't get to live to see his prediction come true, which in some ways makes it almost even more impressive and becomes part of a tradition sometimes of astrologers making predictions about events in the future that ends up being true, but that they don't actually get to live to see. So, for example, last year, I think in August, in the episode on Uranus and Gemini and the Uranus return of the United States, I pointed out and read an excerpt from the prediction of Evangeline Adams that she wrote in the early 1930s, where she had studied the cycle of Uranus and Gemini and had seen, like other astrologers had, that every time Uranus goes into Gemini, that it had coincided with a major war or conflict in the United States. And so based on that, she actually made a prediction in her book in like 1931 that the US would get involved in another major conflict or war starting in 1942. And that is exactly when the US ended up entering World War II, right around that time. So, but then she ends up dying in like the mid 1930s. So she doesn't even get to live to see her prediction come true, which of course it would in a really significant way. All right, to bring this back around to the Hantavirus, I want to share two observations I made recently in terms of like research about the history and origins of this and past astrological alignments that we're having repetitions of right now, both in terms of long-term outer planet alignments as well as shorter-term Mars-Saturn alignments. So the first is that I discovered that it turns out that the hantavirus was first identified and first recognized during the Korean War in the early 1950s. And why that's important right now which is obvious to any astrologers who have been listening to the podcast over the past year, is because the early 1950s coincided with a Saturn-Neptune conjunction. And those conjunctions only take place about every 36 years. And we were having one in the early 1950s, and we're having one again right now, which just went exact in February, but is still very close in the sign of Aries, as we've seen in some of the charts that we looked at earlier. So basically, let me pull up the chart so you can see how this worked out, because it's pretty crazy and pretty brilliant how the sign-based co-presence coincided with the initial discovery of this, essentially, and one of the first widespread cases. So it started in the spring of 1951, and at this time we can see Saturn is in the early degrees of Libra. It had just recently dipped into Libra, and then it went retrograde, and it's about to retrograde back into Virgo. But it means that by 1951, we're in the opening phase of about a 3-year long period of the sign-based conjunction or co-presence between Saturn and Neptune in the sign of Libra. So it's like March of 1951 is the beginning of Saturn in Libra. Then March of 1952, Saturn's in the middle of Libra. Then finally, March of 1953, Saturn is towards the end of Libra, where it completes the conjunction with Neptune. And then by 1954 or so, Saturn is starting to make its way into Scorpio to break the sign-based conjunction with Neptune. So if I back it up back to the spring of 1951, the timeline goes like this. In the spring of 1951, the first recognized cases of a mysterious severe illness, which was eventually dubbed the Korean hemorrhagic fever, emerged among United Nations troops that were stationed along the Central Korean front in the Korean War, specifically near the Hantan River. So by the summer of 1951, by the end of the summer, over 800 UN soldiers in that sector had been hospitalized with this strange unexplained fever, which caused sudden onset symptoms, including renal failure, shock, and internal bleeding. And then finally, pretty much by the war's end, more than 3,000 UN troops had contracted the disease, with a mortality rate hovering between 10% and 15%. So the US Army established a dedicated hemorrhagic fever commission to study the outbreak, but the causative agent remained entirely elusive. So on the one hand, that's really interesting that we can localize the first major identification and outbreak of this to this Saturn-Neptune conjunction, which we're having a recurrence of now. But what's also fascinating about the first one is that it was something where it was mysterious and they couldn't figure out where it was coming from or how it was started or spread or other things like that, which is also really fitting in terms of it being a Saturn-Neptune conjunction, where there are often a sense of like mystery or something hidden or something that's hard to pin down. So that's the first thing I wanted to point out, is that it sort of originates there, and then we're having a repetition of that Saturn-Neptune conjunction now, exactly what, 2 Saturn-Neptune conjunctions later. Yeah, because the one in between was in like 1989, and then the one after that was in 2026. Okay, so a couple other points though. Eventually in the late 1970s, around the time of Saturn-Neptune square, there was a South Korean virologist named Dr. Ho Wang Lee who was able to start to identify it and was studying the virus. And eventually, his team detected a viral antigen in like a field mouse, basically. And as a result of that, they were able to make major progress in working things out. So let me move the chart forward to then, because part of what happened is that it becomes tied in with the Saturn-Neptune cycle. And his discovery and naming of it eventually starts happening late in the 70s when Saturn starts moving into the square, the waning square with Neptune, which starts getting into the weeds in terms of things. But I'll skip over that and I'm going to skip to March of 1980. Because in March of 1980, what happens is Mars goes retrograde in Virgo in a sign-based conjunction with Saturn in Virgo. So in the chart, we can see that like March 2nd, 1980, Mars is at 3 degrees of Virgo retrograde, and Saturn is at 24 degrees of Virgo retrograde. So we have a Mars-Saturn conjunction by sign that's being emphasized due to the retrograde nature of Mars. And what happens at this time is that the name Hantavirus was formally documented and introduced. And the previous doctor I mentioned submitted his final research report titled Korean Hemorrhagic Fever to the U.S. Army Medical Research and Department Command in March of 1980. And in this document, he explicitly stated that the newly isolated agent had been named the Hantavirus after the river where it was infected, where it was infecting field mice. So this name then was subsequently adopted across the scientific literature throughout that year. So do you remember, like 2 years after this, the next Mars-Saturn conjunction that happened in the summer of 1982, that was the Mars-Saturn conjunction where AIDS is officially named and receives the designation and the name under that Mars-Saturn conjunction that it will have even into today. Well, it turns out that the previous Mars-Saturn conjunction was when this virus, the Hantavirus, was named at this time, which is just, or the Hantavirus was named at this time, which is just incredible. So if we jump forward then 2 more years to February of 1982, which was the next Mars-Saturn conjunction, where we see, let's say February 22nd, for example, Mars is slowing down and stationing retrograde at 19 degrees of Libra, conjunct Saturn at 21 Libra, and Pluto at 26 Libra. So this is around that year and the several month period where Mars is just hanging out in Libra for like a huge amount of time, conjoining Saturn by degree or by sign. And when the AIDS pandemic is really taking off, but also starting to get recognized and starting to get named, well, what's interesting is that in February of 1982, the World Health Organization officially unified the disease classification, where the WHO Regional Office for the Western Pacific convened a working group on this virus in Japan. And in February of 1982, after convening this group, during a February meeting, so what happened at this time, at this meeting, is that the WHO essentially adopted a full classification for this group of fevers and a clinical term for what they were describing. So basically, at the first conjunction, it gets one name, and then at the second conjunction, the WHO gives it its own specific classification. So as a result of that, we're basically experiencing two repetitions right now then. On the one hand, we're experiencing a repetition of a long-term planetary cycle, which is the 36-year Saturn-Neptune cycle, which originally coincided with the first major outbreak associated with the virus in the early 1950s, when it breaks out during the Korean War and gets recognized, but is still a mysterious virus. And then we're also experiencing, in terms of shorter term planetary cycles, the repetition of a Mars-Saturn conjunction, which two of them in 1980 and 1982 coincided with the naming of the virus, as well as the WHO creating an official classification for the virus. So neither of these obviously were known to me when I was making my predictions for the year ahead and the year ahead forecast. And I was like looking at that Mars-Saturn conjunction and being nervous about it, or I was looking at that Saturn-Neptune conjunction and being nervous about it. But the reason I decided to make some statements about that was just because of a history of seeing those two conjunctions coincide with different issues in terms of viruses or pandemics or other things like that. And so it seemed worthwhile to state in terms of what might be coming up when we had a recurrence of those conjunctions. And then now that it's happened, we can kind of like identify and start looking back for repetitions to get some sense of what is repeating now and how astrologically the planetary repetitions are tied into its history. All right, so in terms of future transits, when it comes to the Hantavirus, the next major one I'm looking at is that Mars will move into Taurus on May 18th, and that will end the sign-based conjunction or co-presence with Saturn. So this is going to be a vibe shift, and either this will be the point where they will have start to have gotten it under control essentially, and things will calm down, or alternatively, a new phase will begin in terms of dealing with it at that time. So part of it's going to become a matter of how successful they are with doing the contact tracing and basically locating and stopping the spread of it between now and then. And and reaching a point where things start to calm down and become less tense, which we see sometimes happening once the Mars-Saturn co-presence breaks, or in other instances, if it is something that starts to accumulate and like blow up into a bigger thing, then if that was the case, then my next major date to watch out for would happen later in the month, towards the end of May, around May 26th, when we get the Mars-Pluto square, which we identified as the other major problematic aspect that happens this month towards the end of May. And while that's why that's problematic is because sometimes in other contexts, Mars Pluto squares can be associated with like high casualty events, which is one of the things that's problematic about it. And my hope is that by then they've gotten it contained. But if not, then this would be the next important turning point that I would pay attention to. Because, like I've said, the World Health Organization has pointed out that while it does have a higher mortality rate than something like COVID, it has a much lower transmission rate compared to something like COVID. So, in the off chance that this did become a longer term thing that we were dealing with, then we would have to think about the conjunction that just occurred as a seed moment and as the start of a new 2 year cycle, which is something we were seeing sometimes during the course of the COVID pandemic, especially between 2020 and 2022. And in those instances, the most important turning points play out over the course of especially the hard aspects between Mars and Saturn that happen in between the two conjunctions. So in this instance, that would be the important turning points then would be the waxing square, which is going to occur around September 1st, 2026. Then there would be another important turning point with respect to it at the opposition of Mars and Saturn, which will occur August 29th, 2027, and in the area surrounding that, around the sign-based opposition by extension. And then finally, or next, at the waning square, which would be around December 3rd, 2027. And then finally, the closing of the cycle and the completion of the cycle when the next conjunction between Mars and Saturn takes place, which would be around April 30th, 2028. So my hope is that this is something where sometimes when I think about things like this, I think about the issues of fate versus free will, but also the difference between practicing astrology in modern times and some of the ways that we're able to deal with things a little bit better in some instances compared to, imagining if this was happening in ancient times where they can't really do as well like contact tracing, or they may not know how the virus is spreading, or all sorts of other things like that. Whereas in modern times, because we have some of those modern medical and technological luxuries, we're better able sometimes to stop and to suppress or to limit the spread of things like this than they used to be in ancient times. So my hope is that they're getting on top of this, and because it was caught so early and identified so early, and because this is a known thing that we've been dealing with, that they'll be able to limit the spread. And if that's the case, then some of the headlines I would expect will start to die down by the time that Mars departs from Aries and moves into Taurus and starts to move away from Saturn after May 18th. So let's all hope that that's the case and that that's what's coming up in the future. Otherwise, we'll be paying attention to and we'll be checking in the future, especially in forecast episodes, about some of those other hard aspects between Mars and Saturn, and if they don't relate back in some way to something that began in April of 2026, whether that's related to the Hantavirus or something else that was started around that time. All right, so I wanted to wrap this video up by, just acknowledging that obviously this research is not completely comprehensive, but I just wanted to share some of my current thoughts and reactions and some background that I've been thinking about this week as I've been watching the headlines and some of the things that went into my own prediction, as well as give some people some ideas for future research and future avenues of research if one wanted to develop their own understanding of this idea or even come to specialize in it. These are some of the starting points and directions that I would take if you wanted to expand on that. So I hope it'll act as a useful starting point for other astrologers in terms of doing further research into mundane astrology or even epidemiology. I'm not a specialist in this area, nor am I a doctor, nor is any of this meant to be like medical advice or anything like that. But instead, it's some useful starting points and observations, since one of the tricky things about astrology, once you get into it, is astrology leads you into all sorts of different areas of needing to develop at least some basic familiarization with a lot of different fields, because astrology maps and mirrors human experience, and human experience is an incredibly diverse thing. There are so many different areas and topics and subjects that astrology can be applied to. And each of those, in order to really develop a mastery of it, you have to develop a mastery of both the astrology as well as ideally like the specific topic of study that you're getting into. So, if you wanted to study this, then you would want to study mundane astrology as well as epidemiology. Or if you wanted to apply astrology to psychology, then you'd really want to study not just astrology and character analysis through astrology, but also you'd want to develop a really good background, a strong background in psychology or counseling. If you wanted to apply astrology to financial matters, you would have to not just be good at astrology, you would also have to be really good at finance and trading. So that's one of the really tricky things about being an astrologer is, on the one hand, you're forced to some extent to become kind of like a generalist of having a lot of different knowledge or a little bit of knowledge about a bunch of different fields so that you can understand how the astrology relates to it. But on the other hand, obviously each of us has a limitation, because we can't develop PhD level knowledge about every specific subfield that we'd like to apply astrology to. So, I have developed what I can here, and I'm sharing some of what I know and some of what I have observed in terms of some of this. And I hope that for some of you, it'll inspire you to study it more deeply and perhaps take it much further than I have in developing specialty knowledge in this area. And if you do so, then, we will have contributed something to expanding our collective understanding of astrology and how it relates to so many different fields of life, including ones that are not very not very positive, including ones that are kind of difficult and tricky, such as, diseases and viruses and death and things like that. But I think that's it. I think that's it for this episode of the Astrology Podcast. So thanks so much for watching or listening, and I'll see you again next time. If you're a fan of the podcast and you want to get access to bonus content, then become a patron through my page on Patreon, where you can get early access to new episodes, attend live recordings and webinars, access the monthly electional astrology podcast, the secret astrology podcast that's only available to patrons, or you can even get your name listed in the credits. Find out more at patreon.com/astrologypodcast. Special thanks to the patrons on our producers tier, including patrons Christy Moe, Ariana Amour, Mandy Ray, Angelique Nambo, Isa Sabah, Jeannie Marie Kaplan, Melissa Delano, Sunny Bozbaz, Kwatsi Alabarahu, Annie Newman, Ginger Sodlier, Berlin West, and Nikki Crawford. If you're looking for good dates to do things this year, then be sure to check out our 2026 Electional Astrology Report, which is a guide to the most fortunate dates in 2026. You can get it at theastrologypodcast.com/2026 report. If you're really looking to take your studies of astrology to the next level, then consider signing up for my Hellenistic Astrology course, which is an online course in ancient astrology where I take people from basic concepts up through intermediate and advanced techniques for reading birth charts. There's over 100 hours of video lectures, plus live webinars and Q&A sessions each month, and at the end of the course, you get a certificate of completion saying that you studied with me. Find out more information at theastrologyschool.com. If you're looking to get an astrological consultation, then check out the new consultations page on the podcast website, where I have a list of astrologers I recommend for birth chart readings and other types of consultations. You can find that at theastrologypodcast.com/consultations. The astrology software we use and recommend here on the podcast is called SolarFire for Windows, and you can get a 15% discount on it by using the promo code AP15 at the website alabe.com. For Mac users, we recommend the program called AstroGold for Mac OS, and you can use the promo code AstroPodcast15 to get a 15% discount at their website, which is astrogold.io. And shout out to our sponsors for this episode, including the Northwest Astrology Conference, which is happening in Seattle and being live streamed online May 21st through the 25th, 2026. Find out more information at norwac.net, as well as the United Astrology Conference, which is happening in Chicago this year, September 3rd through the 9th, 2026. Find out more information about that at uacastrology.com.